Namaste, I'm Dr. Roshita. I'm here to share a few thoughts on nutritional requirement for preschoolers. So, coming to the topic, we all know that this is the golden period of the life where they grow, enjoy, and get exposed to the external environment. So, optimal nutrition is required for their physical as well as their mental growth. Anything excess or deficient in nutrients will affect their growth. They require energy, and this main source of energy should come from the food, especially the carbohydrate. We Indians usually go for wheat or rice or ragi or jowar, and most probably it will be rice or the wheat. So when coming to the rice, either brown rice or white rice can be given for the kids. And when you give, see to that, if you give 1 cup of rice, the same amount of boiled vegetables or boiled veg curry given, it should be of the same quantity so that it is easier for them to digest as well as for the absorption. And then coming to the protein requirement, it can be from the animal sources or from the plant sources. If it is from the animal sources, try like chicken or mutton. If you wanted to give for your kids, then try to give in the afternoon when their digestion is in the peak, or else you can give soon after they come from the school, because this is the time they tend to eat well. And when you cook meat or this animal protein, try to use green chili or pepper instead of the red chili. That also helps for the easier digestion. Regarding the plant protein, you will be choosing pulses like bengal gram or green gram, anything pulses. So pulses also should be given in the whole. It should be whole pulses. When you split when the pulses are split, then you call it as dal. So dal actually causes indigestion, and they contain very little amount of fiber. Fibers are required for their very healthy bowel movement, like for their passing of stools, and this helps in the regulation of their metabolism too. So always go for the whole pulses, and this can be given boiled. You can add jeera or ginger or garlic, and you can make it tasty. You can just give them boiled pulses also. And then coming to the fat, again it can be of animal or plant. And if it is from animal, like we give ghee or in the form of meat. And from the plant sources, we usually go for nuts also. We should be very careful that nuts should be given only a fistful, how much the kid can hold in their hand. Their fistful, not our, their, it should be of their fistful, of their hand size. And when you give nuts also, give them only 2 varieties per day. You don't mix many varieties, that also will hamper the digestion. The best way to give is 2 cashew, 2 badam, not more than that. They require only that much of nuts per day. Or if you're going for groundnuts, give them a fistful, because what happens is these fats are difficult to digest in the larger quantities, so they should be given in the optimum amount. Iron is very much required too for their cognitive function as well as for their mental requirement. And so while coming to the iron rich content foods are green leafy vegetables, sesame seeds. So you can give them, if you are giving them sesame seeds, make sure that you give a fruit along with it, because these sesame seeds, the content of the iron content in the sesame seed will be absorbed when you give the vitamin C content fruit along with it. You can either fry it and give it, or you can sprout it and give it, but not more than 1 teaspoon per day. The best way to introduce the sesame seeds is with the fruits, or usually we go for avilaki preparations. You can add the sesame seeds. And green leafy vegetables are more rich in iron. And next, coming to the calcium, which is required for their bone and joints. While talking about the calcium rich foods, as we know, it's again the ragi, and the dark green vegetables and red colored fruits also contain calcium. So when you give calcium, make sure that you do not give any sugar content foods like bakery foods, because what happens is calcium absorption will be hindered by the sugar. Sugar actually robs the calcium from our body. That's why most of the time the bakery items should be avoided in the kids. And the sugar has another one side effect, or the very bad effect with the sugar, is that they make the digestion difficult. And the research shows that the children who eat more sugar or chocolates show more tantrum behavior. So make sure that you reduce the amount of sugar you give to the kids. And next, coming to challenges. The challenges in feeding the preschool children. There are three challenges mainly. One thing is that these children will eat very less and they don't stop playing to just to eat. And the second challenge is that they are very choosy. And third thing is they can be assertive, either for demanding the food or rejecting the food. So we should allow them we should actually give them choice and allow them to choose the food. And there are few tips actually how we can overcome these challenges. First, one thing is we should understand that they have very small amount of appetite. So feed them 3 times per day, and you can give in between snacks so that they eat well. And the second point is that have a family time. Like you can eat all whole family together, and make sure that their eating ambience is very good, and the table and the chair is very much comfortable for the kids to eat. And make your meal time has a story time. And so you can even include the stories which contain which tells about the nutritive values of the food, and teach them what is healthy, what is not healthy. You can actually tell them why you are eating those foods, and why you are not eating the foods which will like fast foods, why you are not eating it. Educate them and be a role model. When the parent itself starts eating the healthy food, children automatically eats the same, because this is the age where they are very curious and they imitate what the parents or the other family members do. Never force feed the kid, because what happens is when you force feed the kid get aversion towards that particular food. Instead, find out the reason why the kid is not eating, or why the kid is not having appetite. One reason is the nutritional deficiency, because for example in iron deficiency kids will have loss of appetite. So find out the reason why the kid is not eating well. And the second reason is maybe you will have to recheck the consistency, temperature, shape of the food. So change the shape, consistency and temperature of the food, and maybe that will also work. And so this is the very important thing. And another thing is about the physical activity. Lack of physical activity also leads to lack of appetite. So make sure that kid is active throughout the day and eat well. And when the kid is avoiding the food, don't force feed, because we humans have to be known when to eat and when to not to eat. So that natural instinct should be taught to the kids. If they are avoiding some foods at a particular time, let them avoid it. They will eat it when they have the digestion and when they get the real appetite. So never force feed the kid. Thank you for the patient listening. Follow me on my Instagram page, Dr. Roshi Women's Health, and on my YouTube channel for more details, Dr. Roshita's Yoga and Naturopathic Medicine. Thank you.